Leslie. I'm one of the academic advisors for the Faculty of Science. Thanks for coming to our Discover Your Future Through Science event for the College of Rehabilitation Sciences. We have 3 presenters tonight. After the presentation, if you have any questions, please feel free to ask. And there's 2 of us from the science office that'll stick around as well, so if you have any science questions, you can come and ask us too. Our first presenter is Melissa Campbell, presenting for the Master of Occupational Therapy program. Melissa is graduating this fall with her Master's of Occupational Therapy from the College of Rehabilitation Sciences at the University of Manitoba. Previously, she obtained her Bachelor of Arts with a major in psychology from the University of Winnipeg. Between undergraduate and graduate school, Melissa worked in the area of applied behavioral analysis with children with autism and volunteered with Swim Ability, teaching children with developmental disabilities how to swim. Melissa is looking forward to pursuing a career in occupational therapy with a special focus on addictions and mental health. Our second speaker is Roland Lavallée, presenting for the Master of Physical Therapy program. Roland graduated in 1980 with a Bachelor of Arts in Psychology and in 1983 with his Bachelor in Physiotherapy from the University of Manitoba. In 2010, he earned his clinical Master's in orthopedic physiotherapy from Western University in London, Ontario. Roland is also a bilingual Métis clinician working in private orthopedic practice in Winnipeg. He also has postgraduate teaching and practical examination responsibilities at the provincial and national levels. Roland has been the National Chair of the Educational Committee for Orthopedic Division of the Canadian Physiotherapy Association for the past 5 years. He enjoys the opportunities to mentor with his colleagues who have embarked on their lifelong learning journeys. Our third speaker is Kenza Hayat, presenting for Bachelor of Respiratory Therapy program. Kenza was born and raised in Pakistan and moved to Canada in 2013. Kenza is currently a second-year student in the Respiratory Therapy program at the University of Manitoba. Kenza will be graduating with the Bachelor of Respiratory Therapy in 2020. During her year 1 clinical rotation in May, Kenza spent 3 weeks at the Grace Hospital, ICU, Emergency Wards, and PFT Lab, and 1 week at Children's Hospital, NICU, PICU, and Women's. Kenza spent some time in Norway House this past summer as service learning interprofessional collaboration experience along with other students from the RADY Faculty of Health Sciences. Here she worked on different projects with various healthcare professionals. It was an opportunity to enhance her knowledge and understanding of Indigenous cultures, make connections, learn about the health services available in Norway House, and to amplify her interprofessional collaboration skills. Kenza enjoys taking on leadership roles and is the University of Manitoba's student representative at the Canadian Society of Respiratory Therapists, as well as a member of various other student organizations. Her hobbies include fishing, hiking, and just being outdoors in general. So,
all right, thank you for that introduction, and thank you for all of you guys for coming here today and just showing an interest in the rehabilitation sciences. Hopefully we'll be able to shed some light and maybe you guys will go into the program, any of the programs. So first off is occupational therapy. And I know that at probably your guys' stage, I had no idea what it was, and I still didn't really learn it until I got into the program. But occupational therapy, we're all health professionals, and we enable people to lead more productive, satisfying, and independent lives by facilitating their engagement in the occupations of everyday life. So yeah, what does that mean? Occupation, we see that as anything that occupies your time, literally anything that occupies your time. So, for an example of occupations of everyday life, there's having a shower, there's driving a car, eating lunch with friends, going to work, sitting here, doing your homework, not doing your homework, procrastinating, and watching Netflix, all those kinds of things. Those are all occupations because they occupy your time. So when you imagine, how would you have a shower if you broke your leg, or you had poor balance, or you couldn't even reach up your arms to your hair? These are simple things that we take for granted, and when life circumstances kind of get in the way of being able to do those things, that's when you really realize how much you take for granted those things. So recently I worked in Concordia Hospital with people who had like knee or hip replacements. So a lot of times they had poor balance. So getting in and out of the shower was a thing that they had to relearn, especially with all the different recommendations for how their hip was supposed to move at that point. Or how would you drive a car if you were paralyzed from the waist down, you were fearful of leaving the garage, or you lost the use of your right hand? So it's not just physical, it's also mental. So for people with depression, anxiety, OCD, something like leaving the garage or driving can be such a daunting task. but it's something that really helps with their independence. And independence is a huge thing that occupational therapists help individuals with, because during your day, that's something that you rely on, is your independence, and driving is definitely a way that people can get that independence. How would you have lunch with your friends if you couldn't hold a fork? You couldn't remember where to meet them, or you couldn't cope with getting out of bed. That last one would more kind of tier towards depression, and that middle one, maybe you couldn't remember where to meet them. You have recently had a brain injury, even just a concussion. So learning how to find some strategies to be able to go and have lunch with your friends, which is an important occupation. We're all social beings, so that's really important for us. How would you go to work if you had pain in your back, you heard voices in your head, or you had arthritis? Recently, I was working in an addictions clinic, and for many people, especially with opioids, that's what you're given when you have a back injury at work or something like that. But there's other ways to be able to get through that pain, whether it be scheduling your day in a way that avoids pain or at least minimizes the amount of pain you feel, energy conservation, things like that. So there's many different methods, kind of a holistic approach to be able to kind of target those different difficulties you find in your life. So as an OT, OT is not overtime, it's occupational therapy. And OT, we want to know what occupations are important to a person, what's meaningful to them. So what do you need to do? What do you want to do? What are you expecting to do, or what are you expected to do? So your roles in life. So we look at the holistic part of the person. So it's physical, it's cognitive, it's emotional. We do assessments. We can watch somebody do a kitchen assessment is what we call it. So you literally watch a person cook a meal, and you can see so many things from that, physically and cognitively, and it's really interesting to watch. And then you make further assessments, or you make recommendations based on that. So we also want to know about the environment, because your environment plays a huge role, not only in who you are as a person, but what you can do during your day. So it's the physical layout, the accessibility of it, the tools that you need for the activity. So you might need a modified fork because you can't do this. So you might need a modified fork to be able to bring a meal or bring food to your mouth. Also your social network and your support system, that is huge for your environment. Because if you lose the ability of some sort of independence, it's nice to be able to rely on your family or have that kind of backup. And us as OTs, we need to know that. What are your supports, so we know how to recommend. So when it all gets pulled together, what do you need and want to do? What are you having difficulty with? What strengths do you have? Because that's very important. We don't just look at what's going wrong in your life, what's going right in your life also, because let's work with that and find a way for that to work for whatever area you're having difficulty with. And then also, how do the tools or environment impact your ability to do what you need to do? So as an OT, we might enable the client to do tasks with the abilities they have, like I mentioned, and recommend changes to how an occupation or activity is done, because you might be able to find an easier way to do it. So we work to improve or maintain abilities in strength, sitting tolerance, fine motor dexterity, coping strategies, anger management, concentration, the list goes on. This is definitely not extensive. And we also adapt the tools and our environment. We are experts in wheelchair provision. So whether that be assessing and prescribing wheelchairs, we're very much experts in that. We learned that in school on how to do that. And also assistive technology. We are, that's a field of OT that you can specialize in later on after school. So, and we work with people of all ages, all backgrounds, the young, the old, I've worked with kids who are under 5 years old. I've worked with elderly over 90 and up over 100 years old. You work with everybody, and it's great because you can find an area that you love and what population you would like to work with. And so yeah, along with the ages, you're in so many different facilities. So hospitals, schools, mental health facilities, home care, personal care homes, private clinics, rehab centers, community health centers, insurance companies, clients' home, client workplaces. We're literally everywhere, and I'm saying literally a lot because literally we are everywhere. So these are some OTs that they were students, and they're in so many different areas now. So for an example of all the different areas that we're in. Will, on your left, is a musculoskeletal injury prevention specialist for the region. Katie is a community addictions worker. Fatima is in private practice, and she helps people return to work after motor vehicle accidents. Kendall works for a school division and then also works for Children's Hospital. And Jordan is now an executive director of a mental health agency, and he previously worked with individuals with schizophrenia. So it's been shown in studies that OTs, people go into occupational therapy because they've had contact with an OT or know somebody who have worked with an OT and heard about what they do. So if you guys are interested in learning more about OT or just connecting in a way, then you can definitely talk to the College of Rehabilitation Sciences. We're more than happy to connect you to somebody out in the community or even at the school. And just a little bit about myself also. So the different placements that I had throughout my last 2 years, we had 4 placements. One was at Concordia Hospital working with hip and knee injuries. Second one, I was a community mental health worker working out in Brandon, and I got to work with people with schizophrenia, bipolar, depression, OCD, all different mental health conditions. And we basically just sat and had coffee, and we talked about their day, made sure that they were connected to the resources that they needed in their community so that they could thrive. My third placement, I was out in Saskatoon, and I was working in a school, and instead of individual people being my clients, the school was my client. So I implemented big programs for the school to do with fine motor programming, as well as like body breaks. So making sure the kids got out of the classroom, had a little bit of a break if they needed, and then could go back and concentrate on their work. So we had designed a body break room in 2 schools for that. So that was really neat. And the last one that I did was in addictions, and I was at Health Science Center working in the inpatient addictions detox unit. And so I did group therapy there and also just one-on-one discussions and assessments, as well as working in the opioid assessment clinic for those with wanting opioid replacement therapy. So just from that, from my experience, I've worked in so many different areas, and that's not even all of them. So you really have the choice, and that's one of the great things about occupational therapy, is you have that choice and you can change it anytime what area you want to work in. So how do you become an occupational therapist? It's a 2-year program. We have academic coursework and fieldwork experience all mixed in. And you do problem-based learning, you have regular classroom, you have like physical learning, like practical applications of it. And it's a really great program. I enjoyed it thoroughly. So the application for the fall 2019, so next year, if you're an international applicant, it's January 15th next year. If you're from Canada, it's the February 1st application deadline. And then the admission interviews are scheduled to take place on Saturday, April 27th of next year. So you need a 3 or 4 year undergraduate degree in any area of study. So I know some of my classmates have a physics degree, some have zoology, some have music therapy, I have psychology, everything. Everything counts. You just need to have the prerequisite courses listed here. So anatomy, stats, social sciences, physiology, and psychology. Minimum grade of a B is required in each of those prerequisite courses, as well minimum GPA of 3.0 or a B in the last 60 credit hours of study. Typically though, you can check on the website for the most recent GPA, but those that are allowed an interview is like 3.5 and above. So if you are wanting to get into the program, it is pretty competitive, and it has been getting more competitive every year. So yeah, you can always visit the website for more information. There's a lot of information on there. And if you do have more questions about the program, you can always contact CORS, the College of Rehabilitation Sciences, at their email there. Yeah, that's all I got to say about occupational therapy.
Great. You bet. Thank you, Melissa. Great job. Good evening, everyone. My name is Roland Lavallée, and I chair admissions for physical therapy at the college. The presentation Melissa just gave is a great understanding of sort of the span of healthcare. And the great thing about CORS is we interact, and we want to create a teamwork approach to healthcare. So to get people to do some of the things that Melissa was talking about in her presentation, the physical therapist is obviously prominent in that piece as well. The roles cross over in many ways, but in some ways that we'll talk about today, they differ. So probably from the point of view of injuries, physical therapists are taking people maybe in that very earlier part of their time where they've just broken their leg or they've had a hip surgery, with the goal that we know they have to be more functional and that they might be connecting with an occupational therapist. We bring them to that point so that they can actually start doing things in the community. So it's a hands-on type of profession, and we're medically managing them in the different phases or the different types of healthcare that need to take place. We all try to be as science-based as we can, and from the clinical point of view, that's crucial in the part of care. And like all groups of healthcare practitioners, we're trying to move that equation further and further so that we're delivering practice, we're delivering treatments that are evidence-based. And that's the kind of the exciting part of moving through any sort of program from the point of view is knowing that it's effective, and we have to test ourselves that that's effective. So we work in many types of environments, certainly hospital-based, inpatient type of clinics. We are in long-term care home facilities. We do home visits throughout, and probably of a large proportion in physical therapy is that you see them in private clinics. Physiotherapy has direct access. That is, an injured patient can come into my clinic and seek care. And I work with the different practitioners, but it's a legal approach that they're allowed to come see me in that first instance. Groups like workers' compensation, if you had an injury at work, you could come to see me directly. So that direct access is an important piece of our independence that we have in healthcare. And of course, people walk in all the time in clinics, so that there's a lot of variety that comes through as we work through. What exactly do physical therapists do? So if we look at any condition along the sides of the body, we can look at a big part of what we would do is treating people's pain for a whole host of different reasons, and going through that process in a way that takes them from controlling pain into having more mobility and to becoming strong to do practical and functional things. Balance is always part of that, cardiovascular care and what it takes to do certain jobs or certain sports. Physical therapists are there in a very proactive way. Probably most people see us as the professional that knows a lot about exercise. So in my clinical practice that I do, I'm teaching people to exercise all the time. That is an important part of what we do. And probably most people who are attracted to come into physical therapy have a strong exercise base in their knowledge and want to move that forward. And we do that with all different types of clients. Making them independent, making them manage their own care, that's part of what we do. So on the musculoskeletal side, people with back pain, neck pain, arthritis, people who've had joint replacements, sports injuries of all types of sports. And we're trying to do things to control their pain, increase the mobility so they can do more. And then hopefully, likely prevent future injuries or get them ready for surgery. So total knee operations is a good example of getting them as physically prepared as they can, because of course once they have their surgery, they're going to have a deficit in function, that if their function was higher prior to surgery, they're going to have a better result. So physical therapists work along that process as well. So if you leave the neuromusculoskeletal process, we work into another body system. So anything having to do with the cardiac system, the respiratory system, physical therapists work in that domain as well. So you could list all those conditions: heart disease, cystic fibrosis, chronic obstructive pulmonary disease, and post-surgical care. So your older adult, perhaps grandfather who's been in care, breaks their leg, comes into the hospital, there's a high risk of pneumonia. So physical therapists are there to make sure that they don't develop that sort of complication to their care. So you'll see physical therapists in that domain as well. People who can't breathe, that's a tough situation to be in, and being able to improve that ability to have more physical output without the risk or the fear of not being able to breathe appropriately, physical therapists are strongly involved in. So if you leave that sort of musculoskeletal part, leave the cardiorespiratory part, physical therapists work in areas dealing with the neurological system. So anything having to do with the brain, the spinal cord, the nerves. And you'll find physical therapists that tend to specialize in maybe those different areas, but this list is a good example of what physical therapists, of what conditions physical therapists work in. Developmental delay, so kids who are trying to move through that process of development. Parkinson's disease, spinal cord injuries, stroke, and physical therapists are doing things to try to improve their balance, their strength, their mobility, get them to be able to use maybe mobility aids in a efficient way or in a progressive way to reduce their pain, and hopefully give them that feeling that they can move forward, and that will do things like improve their mood and help them along the way. So it's a master's program. Like occupational therapy, you need to come in with an undergrad degree, and we're, of course, pretty flexible in what type of undergrad degree, but we will have a group of prerequisites that I'll list very shortly. Our program has many types of learning for the adult learner, whether it's clinically based learning, that you're in community, you're in clinics, academic learning, class learning, practical learning, and other types of learning that take place in the community. So we combine all of that. I think much like the occupational therapy student, it's a whole different type of education that you're actually applying to do the things that you've learned about. You know certain muscles, well, how do you deal with those muscles? Or you know aspects of the science and anatomy of different conditions, and how do you improve that on somebody? So it's that next level of learning. You're applying, you're clinically reasoning, and that's kind of the exciting part of being able to do things with the stuff that you're learning in this faculty, in science. All those things are sort of important background pieces that when you're within the program, in a master's program or in a bachelor's program, that you're applying that type of stuff. So our application dates are definitely earlier than occupational therapy, so keep that in mind. Our application deadline is November the 15th of this year, where OT was in the new year, right? So the website is open. You can start looking at what you need, and you more than likely, if you're thinking of a physical therapy master's program, you're already kind of hopefully understanding what you're looking at. We need those marks by January 31st. So some students who might be doing maybe an online course through Athabasca College because they wanted to get they needed another anatomy course. If we don't have those marks by January 31st, we can't complete your application process and offer you an interview. So that's a very important date. Those marks have to be in by January the 31st. We use an interview process called the MMI, multi-mini interview. This university for U of M students have seminars in January. So you have to, so student services or career services. Career services, you have to get your name in that to be able to go to that seminar. It's about a 3 or 4 hour process, and I strongly recommend that you do that to understand what the MMI is. If you need more information about the MMI, that's what I'm for, and you can certainly contact our college and we can talk that through. But know the MMI is something different. It's not a typical interview. It's actually a pretty interesting interview. Most students like the MMI for lots of different reasons. So look that up if you're following through. And if you're thinking of applying next year, maybe you still want to do the seminar this year to sort of look at and think about the types of processes that are involved in the MMI. You must be a Canadian citizen or permanent resident of Canada to apply to the program. 3 or 4 year degree of any type is allowed. You have to have at least one of those years to be a 24 credit hour year. So that's an important requirement. You need to have a 3.25 in the last 60 credit hours of study, and you need a B in all of those required prerequisite courses. And the completion of that course must be by December 31st. Here's the list of prerequisite courses. U of M students, you could look on the website and you can find them pretty much set there. If you don't see the course that you would like to think that could be a prerequisite, that's when you contact me to try to figure out would that course count. The list is very long, and what's on the website isn't all there. So make sure that you ask. Just don't assume you don't see it. It still might be okay. So that's very important to keep in mind. English is an important topic here, and some students don't necessarily need an English department, don't need 6 credit hours of an English department course. 3 credit hours must be English department course. But if you had a history course or any other humanities course that made you write at least 60% of your marks connected to those to writing, that history course could be used instead of another English course. So keep in mind that can exist. We would also take 3 credit hours of a French course. So we are equal in that language base for that as well. So that's the place where I got a lot of questions about English. Anatomy is another place. Our physiology course is a lot of information about that too. Make sure that you keep track of the limitations. So if your physiology course is 6 years old, you might need to take another physiology course or a higher order course. And the same thing with the other courses. There's a website. You can certainly connect that and then look for those questions that you might have. And certainly I'll be here after if you have special questions as well.
Good evening everyone, and thanks again for coming. As mentioned earlier, in course we are all pretty much related. We are all rehabilitation sciences. As Melissa said, she helps someone with a broken leg to help learn them drive, take a shower. Raleigh said he comes a step earlier in their care and help them manage the pain, maybe while they're still in the hospital. And respiratory therapists, we come a step even earlier than them, as soon as they probably had a motor vehicle accident, broke their leg, and they're coming through emergency doors. Maybe they had a stroke, maybe they had a clot, they had a cardiovascular arrest, and they need some immediate help. So we mostly deal with critical patients. So what respiratory therapy is a scientific application of technology to help assist in diagnosis, treatment, and well-being of patients with respiratory or respiratory-related diseases. In simpler words, it's helping patients breathe who has respiratory or associated disorders and who can't breathe at their own, using various machines and technologies. So what do we do? Airway management. So airway management is removing an obstruction or keeping an airway from collapsing. It can be just basic or advanced. Basic means just do some maneuvers, head tilt, chin lift, or rub at the back and they have some obstruction, it comes out. Or advanced means they need to have a hole in their neck, tracheostomy or laryngectomy. They have to have their larynx removed, or they have to have an ET endotracheal tube inserted to maintain their airways. Ventilator management. We are the ventilator specialists. So ventilator is a big fancy machine that helps you breathe when you can't at their own. It can take complete control of your breathing in case of someone have a neuromuscular disorder or can't just breathe their own, or it can just assist you. So most physicians have their favorite modes and favorite ventilators, but they don't know quite as much about ventilators as we do, so we are the specialist. Cardiac resuscitation, trauma team members. So if you have watched Grey's Anatomy, you would know what that means, code blue. So anybody who has cardiac arrest may be related to a cardiac disease or it can be respiratory. In children, it's usually respiratory, can be cardiac. And a person comes in the emergency room, maybe they had an accident or they were in a house fire or they just had a cardiac arrest. So we are member of that team. We help them maintain their airways, do CPR along with other healthcare professionals. So arterial blood sampling. Most of you probably seen lab work done, but that's different than that. So when you go to a lab to get some tests done, they do it through your veins. They take your venous blood and you can see your veins. Those are the blue veins that you can usually see. But arterial blood sampling, as it says, it's through the arteries. You can't really see the arteries. You just have to feel for it, sense it, and then we don't just take the samples, we then analyze them. So analyzing means you just run the sample through the machine, get the report, and blood sample, arterial blood sample can tell you so many things. What's going on with the person. So it can give you concentration of different gases in your blood, your hemoglobin levels. It can tell you your acid-base level, electrolytes. It can give you a pretty good idea if a person is having a respiratory related issues or if it's just a metabolic issues. Patient transport. So when I say patient transport, it doesn't mean calling 911 and when the paramedics and firefighters come to your house. No, it's from one facility to another or from one city to another for the patients who have cardiac or respiratory related issues and they're on the treatment and they maybe need to get transported to bigger facilities where they are going to get a procedure done, or if they are living up in north or remote areas where they need to be transported to the bigger facilities. So it can be an ambulance or it can be air bus. So there are different companies that do that. I know a children's hospital here, they have their own team, mainly consists of respiratory therapists and nurses who go up north or wherever needed and bring patients back. To be a transport RT, you have to take an additional course or additional training, on-site training, and it's an ongoing education. And transport RTs has a wider scope of practice, can write multiple orders, just like a physician when they're en route, and can do way more procedures than an RT in a hospital can do, so that come with a different wage. Non-invasive ventilation. Invasive is when you need to make a hole in your neck or in your trachea larynx to help you breathe. Non-invasive is when you just need a nasal prong, a mask or something to help you breathe, just an additional little boost. It can be before a surgery or after a surgery. It can be during a surgery anesthesia. It can be for sleep disorders. If you find yourself waking up at night gasping for air, you may need an equipment at night to help you with that. Diagnostic testing, so that's like your sleep labs or your lung function testing, spiros, that tests you different things about your lungs, how well is your lung functioning, how much volume it can hold, and all the different things. Can be different allergy testings and stuff. So there are diagnostic labs in the city. If you want to work just specifically for them, there are additional certificates and stuff that you have to do, but through U of M, when you are in the program, you are equally qualified to do all those things. And if you're in a hospital and they have a PFT lab, you can simply work there without taking any additional course. And you're also involved in long-term community care, so that's for the people who need consistent O2 24/7 due to various different reasons. Can be a neuromuscular disease, it can be just they have a COPD exhibition, can be anything, or like, so we work in with home care companies like Rana, Vital Air, Medigas. There are so many different ones in the city, and we go to those patients when they get discharged from the hospital, and physician write an order that this person need oxygen on the maybe temporary or permanent basis. So we go to their home, assess them, teach them how to use the equipments and the safety, because when there is oxygen there are various risk factors. And we provide them with the equipment and the teaching, and we are just basically the contact person for them in case they have any emergency or if they ever run out and stuff. So what some of the other things that we do is diagnosing areas, again, testing, anesthesia assisting. So that's another on-site learning thing that you can do. You can be anesthesia assistant. Education, just like our professors, you can just teach. Can be other type of courses, like there are tobacco cessation programs, you can teach with them, research. You can come up with new ventilators, new modes. There are hundreds of modes coming out every year. Health promotion, again, teaching programs like tobacco cessation, and disaster relief teams. Where do we work? We work at hospitals, acute care, ICU, wards, emergency, everywhere. Long-term care, community care, rehabilitation centers, clinics, and private healthcare, transport. Who do we help? All age groups, from premature babies who don't even have developed lungs yet, or to newborns, children, adults, the elderly, patients who are newly diagnosed with a disease or with a chronic disease or with emergency care or just palliative care. So at U of M, it's a Bachelor of Respiratory Therapy program. That means it's not, you don't need to have a prerequisite or like a degree beforehand. All you need, it's a 3-year professional program followed by a 1 year of University 1, and so that's a total of 4 years of program, so you don't need to have a degree beforehand. So the deadline for the fall 2019 is April 1st, 2019, and then there are interviews. It's not exactly MMI, but it is multiple different interviews. It will be held on June 8th, 2019, and it is a competitive program. There are 16 spots, and it's 1 admission per year, and you need a minimum of 24 credits by April of 2019 in order to apply for the 2019. And there are mandatory courses like biology, 10/20, 10/30, 10/10, psychology or physiology. You have a choice to psychology or sociology. You can take either one of those, stat, and then a writing course. So for the GPA calculation, you can go look at the website for more details, but there are 2 different criteria. So one, for those who have taken 24 credits in 2 consecutive terms, they can apply if they have a minimum GPA of 3 with at least a B in every course. And for those who hasn't taken 24 credit hours in 2 consecutive terms, they have to have a minimum of 3.5 and a B+ in every course. And yeah, there's a website you can go on for more information, and I think that's about it. So, Raleigh.
Thank you. I think this is about the last slide. If there are some pamphlets here, if you want to take any of those pamphlets for more information. In my job, I see this a lot. People haven't necessarily figured out those requirements, nailed them down. They make an application anyway, and then they find out that their application doesn't count. So the early bird gets the worm. I really strongly urge you to do that. It'll reduce your stress, and it's strongly recommended that you do that. We communicate to you, but sometimes things go into the junk email, so make sure that you keep a good eye of if you're expecting something from us, or from any of us, make sure that you're checking your junk communication there. Job shadowing, crucial piece of trying to understand what these professionals do. So strongly recommend that you do that. There's a career mentor program that exists, and we would help you do that as well in trying to connect to somebody in the community. So you can connect with career services. Of course, there's a web page there that you could also access to try to get more information. Keep in mind, this is a really good date. Third Sunday of every January, there is an open house at our college. Good opportunity to talk face-to-face to different students, see our facilities, and just got to get a sense of what it's like to be in a rehab science faculty. We like to think we're the best, and we probably are. Yeah, lots of great energy that happens in our program. So come and visit us and talk to the experts, and that is the students who understand what it's like to be in our program. We're at Bannatyne campus. Take a peek. I'm sure any of us will take a question right now if you have something to share, and we'll certainly go ahead. Yeah, for which program?
For physio.
Okay.
When do you find out if you get an interview?
Sure. So we need those marks by January 31st, and in February, within those first 2 weeks, we're checking our list and making sure that everything. Sometimes we're still trying to pull some information from some students that still could be competitive, but by mid-February, because our interview this year is going to be March 2 and 3. So there's about a 2 to 3 week heads up of the interview. So mid-Feb is a pretty close understanding. If you're waiting, you can always contact us and we'll give you some heads up. But it's usually because we're waiting for some straggler marks to pop in, and that's probably a competitive student that we have to hold on to. So mid-Feb. Which program?
Occupational therapy. So do you have any statistics for admission or anything? Because I see that these programs have very little seats.
The statistics of admissions, so 50 people get in each year, and the amount of people that apply is 200 this past time.
Yeah, 2+.
When I applied, I think it was 180. It's really been increasing over the last couple of years. It actually says it on the admissions website. They have all the stats of the recent years and the GPAs that have been the average GPA for people who get in. And for those who get interviews too, they kind of separate the two. So you can check the website for that, for sure, for the most up-to-date one.
Yeah, I'm pretty sure OT has it. I know we have that stat about the GPAs that get in, how many from the different, there's different candidates that can get in, so it should be there. Again, thank you for your attendance, and I'm sure if you want to ask a question privately, we're happy to. Thank you.